New alarming concerns over care at a mental health hospital.
It was wrong. There's nothing you can say. Nothing's going to make that better.
New questions over what went on at Clearview Behavioral Health.
It's just kind of, it's another part of the puzzle, isn't it?
New emails exposing a so-called smoking gun against the facility.
Did you ever expect to see this kind of information in an email?
2 years ago, a series of reports by Denver 7 Investigates led the state to shut down Clearview Behavioral Health in Johnstown.
And now Chief Investigator Tony Kowaleski asking more tough questions about emails attorneys don't want you to see.
Surprised you received these emails?
Shocked.
Visually, it's nothing more than words on paper.
Your reaction to this? Your husband lost his life in that facility.
Why didn't he lose his license?
In reality, they are two emails authored by a doctor exposing critical care questions about what went on inside this Johnstown mental health hospital.
My reaction was, wow, this is some pretty powerful evidence. I called it a smoking gun.
Attorney Jay Rynan received the emails provided by the doctor's attorneys. They are telling public records and a key part of his lawsuit against the stakeholders connected to Clearview Behavioral Health.
We begin, though, with breaking news. The state is shutting down a Johnstown mental health facility amid concerns of patients being mistreated.
Prior to the state's action back in 2020, patients, family members, and insiders trusted Denver 7 to expose what they described as the secrets inside the privately owned mental health hospital.
People need to know what goes on inside those walls.
You can't treat people the way that they treat people. People are not animals. People are not paychecks.
They're paying for therapy. They're paying to get better, and we're not helping them get better.
It shouldn't take the news media to make something happen.
I think that it was your reporting that started all this into play.
And now perhaps the most significant development of all, this email written in 2019, a few weeks after 5 different critical reports by Denver 7 Investigates. It was sent by a psychiatrist responsible for patient care at Clearview.
I've been admitting to Clearview for the past 2 years without seeing a single patient.
Rynan is reading the words of Clearview psychiatrist Sohail Punjwani. By all indications, the doctor is raising concerns about his role at the hospital, about the risks he's taking. The email concludes, "I am doing all this work at Clearview with not a single clinical visit to my credit for 2 years. Just stress and risk of exposure of my name to media and risk to my license."
He's writing to his boss complaining about having to sign all of these legal documents and do all of these care items without actually seeing patients there.
Is that allowed?
Our experts say that it's not.
And this public court filing also cites another email claiming Dr. Punjwani saw 1,413 patients in a single month, described in the document as an enormous patient load.
Do you know the name Dr. Punjwani?
Oh, for sure. Never seen him. Allegedly lives in Florida.
This mental health tech spent 6 months working at Clearview. He asked us to disguise his identity because he feared retaliation. He confirmed multiple times what Dr. Punjwani put in writing.
Punjwani I've never seen at the hospital.
And just a few days after that first email where he admitted never seeing patients, Dr. Punjwani sends another troubling and illuminating email.
I look at this email and I think, gosh, I mean, that's a pretty powerful statement for him to make, that I may have ordered the medications for Mr. Hitte that resulted in his death.
In fact, that email followed this story by Denver 7 Investigates, raising questions about the death of 47-year-old Tibor Hitte at Clearview.
They found him not breathing.
She was working inside the day the father of 2 died. She feared retaliation and also asked us to disguise her identity.
You watched this man die. Do you wonder if it could have been prevented?
Every day.
In his email, again to his employer, Dr. Punjwani included a link to that Denver 7 report. He writes, "Here's a new article specifically inciting as-needed medication ordered by doctors that killed the patient." Punjwani continued, "Medication probably ordered by me on call, who never saw the patient. The sentence ends with several exclamation points.
What's that say to you?
That he knows he's responsible.
Tibor was Jenny Hattay's husband and the father of their 2 children.
Why do you think he wrote this email?
Because his conscience is screaming at him.
Tibor's wife shared this chilling video diary.
My pledge is to take better and better care of myself.
Her husband made the recordings just 4 days before his death.
I hate that I can die anytime.
Does Dr. Punjwani owe you and your kids an explanation?
Absolutely.
Hi, how can I help you?
Hi, Tony Kowaleski here from Denver 7, trying to reach Dr. Punjwani.
All right, door's open.
Hoping to get answers, we traveled to Colorado Springs and a facility known to employ the author of the emails now in question.
Hi, how are you?
I'm doing well.
Once inside, the facility sent out the director of compliance.
Trying to reach out to Dr. Punjwani. Is he here today?
He is not here currently. What would you like to talk to him about?
We want to talk to him about some public records.
Okay.
Emails he sent in connection with Clearview.
Okay. So we're not associated with Clearview as they've closed.
Right. It's really important I talk to Dr. Punjwani about
Okay.
these documents.
Okay.
Can you make sure to let him know that we're trying to connect with him?
I can do that. Absolutely.
There's my card. It's now out in the open. What needs to happen?
Powers that can enforce this kind of thing need to enforce it.
He has a license to practice medicine in the state of Colorado.
It needs to go away. He shouldn't have that license.
Attorneys for Dr. Punjwani and the company that signs his paychecks declined our request for an on-camera interview. Instead, they elected to provide statements. Both said they did not want to address in the media the issues we've discussed and the emails we've uncovered. Instead, they will now make their cases in front of a jury. The civil case is scheduled for trial in early 2023. So now the question, how will the state's Board of Medical Examiners react to what you just watched? We intend to ask that question. I'm Chief Investigative Reporter Tony Kowaleski.
And Denver 7 Investigates has spent years digging into concerns over Clearview Behavioral Health, and you can find all of our reporting right now at denver7.com.